Hi, I'm Thibaut. I'm a dentist here at 3Dental and I specialize in endodontics. There are different reasons why a root canal treatment would be necessary. The typical case would be tooth decay left untreated for too long, sometimes going unnoticed, and eventually reaching the nerves inside the tooth. That can lead to severe pain, abscesses, or swelling. When it happens, we only have two options. Either we go ahead with the root canal treatment or we take the tooth out. The point of the root canal treatment is to only remove the dying or dead nerves and preserve the rest of the tooth. A lot of patients would be very nervous about the idea of getting a root canal treatment. Root canals are done under local anesthesia. As the tooth will be completely numb throughout the procedure, there won't be any pain at all. In fact, patients needing a root canal treatment usually have been through an awful lot of pain. The only thing that will stop the pain is the root canal treatment. Root canal treatments carried out with the right equipment and protocols have a very high success rate. The inside of the tooth being so tiny and complex, it is essential that your root canal treatment is carried out with the help of a microscope to guarantee the highest success rate. Here at 3Dental, all of our root canal treatments are done with the help of the microscope. On this X-ray, we can clearly see the dark halo around the root. This darker patch is the bone going away from the tooth as a defense against a dental infection. At this stage, the tooth is loose and pain and swelling are very common. Here is the X-ray that we took right after I completed the root canal treatment. This white line that you can now see on the X-ray is the root canal filling material. Once the root canal is complete, not only the pain goes away pretty much at once, but also the bone starts healing and growing back. Another X-ray taken 9 months after the root canal treatment has been completed shows a perfect healing of the bone surrounding the tooth. At this stage, the tooth is not loose anymore and it's not giving trouble to the patient anymore. The price for a standard root canal treatment can vary depending on the type of tooth treated. For example, an incisor usually only have one straight canal. These teeth are often easier to treat than molars, where the root canal anatomy can be a lot more complex with 3 or more curved canals. If you think you might need a root canal treatment, book in for a consultation with me so I can assess the tooth, take an X-ray, do some tests and see what's going on exactly with it. For more information or to book an appointment, please visit 3dental.ie.